Hi everyone, this is as every Thursday, this is our live session with Dr. Jeff. Ask Dr. Jeff. So have your questions ready regarding plastic surgery. We already have some of the questions that you posted on our Instagram stories. And now we're waiting for Dr. Jeff to join our live session. Okay? Let's see. See where he is. There he is. Hi, Doctor.
Oh,
How
all
are
right. Hey there. I'm sorry about that.
you? No, you're good. How are you doing, Doctor? How's been
Oh, I'm
your
doing
week
doing pretty good. Busy week.
and your patients?
Patients are doing great.
Okay. Well, Doctor, I had the questions here, but my computer just turned off. Let me see if I can turn it back
Nice.
on. um, but one of the questions that I have here is like if you do HD ab etching.
Yes, of course we do. That's high definition, right? It's abdominal etching. Sure, we do that all the time. It's
Okay.
really I'm just moving around here. It's really ideal in the case of liposuction or conjunction with the BBL. But yeah, we do that for sure, both male and female.
Okay. And the other question is like, how long should I stay in Miami after a combo tummy tuck and breast lift?
That's a great question. Preferably 7 to 10 days.
Mm-hmm.
All right, that gives us an opportunity to see you following surgery several times, depending on the procedure. You just mentioned that we can initiate massages, we can make sure that you're healing nicely, that you're really moving along in the early phases following surgery before going home. So for me, for a combo, typically 7 to 10 days.
Doctor, do you do rhinoplasties?
Of course, done
Mm-hmm.
several this week, as a matter of fact.
Oh, really? Oh,
Yep,
nice. Oh,
yep,
wow.
yep, yep.
And also, okay, I have like
And people
some.
have to, that's a very special group of patients, actually, excuse me,
Uh,
because there's a lot of swelling following surgery. So it really takes really 9 to 12 months to see the final result. And we really have to look at photos or see a patient in person, to have a consultation and discuss their goals. Because sometimes, patients come in with very thick skin. That's going to have a very different effect, and result than somebody who comes with very thin skin. So patients need to understand these things. We're modifying both the bone and the soft tissue, the cartilage during these procedures. So it's a more complex procedure that requires a little bit more time to explain the goals and the strategies involved. So that's a great question. But yeah, if you're interested in modifying your nose in any way, send us some photos or come in and we'll have a conversation.
and doctor, this is from Love Peace 139. Why do your BMI have to be so low? And you have what do you mean so low?
Well, my limit is 38. So
Thirty-eight.
if they consider that very low, then we have a disconnect. So I'm not sure, what she's asking or he's asking, but our limit, our cutoff is 38, which is really quite high, actually.
Mm-hmm.
Um, so we don't want to go really beyond 38. We want to, in that case, we want to lose weight before surgery and then go ahead with surgery. And in many cases, most cases, we're going to want to lose 10% of body weight after surgery, after liposuction, tummy tuck, all body contouring procedures. We want to lose that 10%, and that's going to give us that best result down the road. So maybe she can clarify her comment, but the limit is really 38.
She said, you have other people on here with high BMI in there getting surgery.
Yeah, the limit is 38. So, okay.
No, that's like
All right.
normally like that's the top, and then like it's also like a safety reason for that.
Right. Well, someone who say like 5'4" and weighs about 215 pounds, there would be a BMI of like 37. It's about
Mhm,
5'4", 215 pounds. All
mhm.
right. So if they would say 225 or so, they'd be about 38 or so. Right. So that's 5'4" and about 225 pounds. All right. So if somebody comes in and they're about the same height and they're 250 or 260 pounds, that's going to be, beyond 38. It's going to be 39 or 40 or 41. And that's just too high for safety reasons.
Okay, great. And Yaya with attitude, she says, "Hi, doctor. I'm coming to
Hey
see
there.
you March 31st
All right.
for pre-op, and I'm super nervous for my tummy tuck and breast lift. I'm so scared.
Oh,
Like,
that's great. Because if you weren't nervous, I would be. All right, so it's totally
what can
fine.
I do to calm my nerves?
What can you do to calm your nerves? Yeah, and maybe espresso martini or something like that to relax. But we do this every day. This is my 26th year in practice. We do this every day of the week. So you have nothing to worry about. There's nothing unusual about it. It was a tummy tuck breast lift procedure. There's nothing unusual. We do those every day, all week long, week after week after week. So, nothing I could do other than tell you that, assuming there are no other medical conditions, everything else is fine, that you should do just fine. So I would take a breath and relax.
Take a deep breath.
Exactly.
Um, okay, so this is from Amberly. Does J plasma wear off after a certain period of time, or does skin remain tight as long as there is no weight or gain loss?
Yes, if you use J plasma today, then you'll be tight for like 50, 60 years, No, actually, it's not that it wears off. It's that first, if you see the real result at about 6 months after you use the J plasma, okay, that's when we see the final effect, if you will. And then as far as wearing off, it doesn't really wear off. It's cause tightening, but again, anything like weight loss, weight gain, other things age over the course of time. So the changes in skin will continue. So it's almost like tightening things and setting them back a little bit, like a facelift procedure, right? So we set the clock back a bit, but then the clock starts going again. So I think J plasma is a very good procedure, for the selected patient. But will it stay tight forever? No, it won't. All right,
Yeah.
but it may last for a couple of years, that sort of thing.
Yeah.
But like all things, gravity is the enemy,
Yeah.
and gravity starts when we get back to the recovery room following surgery. So, but it's definitely a beneficial technique for sure.
Mhm. Yeah, the body is changing every day.
Changing and it's moving forward, right? So every day we're a day older, and your skin knows that, and body, parts of your body know that, but it definitely resets things to some extent for sure.
Nisha is here. Nisha just had surgery, and I believe she had surgery with you, doctor. She always joins our live session.
Okay.
Hi, Nisha.
Hey
And
there.
I don't remember exactly what procedure she had, but she's asking, are headaches common post-op?
Headaches can occur post-op from the anesthesia. Sometimes we see blood pressure variations during procedures, and sometimes that can cause a headache, in the immediate post-op setting. But a few days later or a week later, that should not be persistent. So don't worry. I mean, it may be a day later or so, or a few days, but sometimes that can occur. And you just take your pain medication. You could take additional Tylenol, but that should resolve. Again, if somebody has a history
Hmm.
of migraines or a history of chronic headaches, then that might have a different, effect following anesthesia. So everybody's a little bit different. But for somebody who has no real history of headaches, that should resolve. That shouldn't be an issue.
And I remember, like, because we had this conversation with when I had my BBL, because you have to sleep on your belly all the time, mostly of the time. So that position, like normally, and also the painkiller, the Percocet, that position generates like a headache, or yeah, headache.
It can. Yep, it can. Some people can find that a little bit
But I think it was
awkward
because
or
of the
uncomfortable.
position.
That's a possibility for sure. But if that's the case, then you need to just change positions. Then just
Yeah,
flip over and use the BBL pillow. So
exactly.
that's why some of you have combination patients that can never be on their belly. If they've had a tummy tuck, they'll never be on their belly. With a BBL. So we have to protect the tummy tuck, but the BBL we also protect with the BBL pillow. So that's a great question. But yep, keep us posted if that remains an issue.
Yes. Thank you, Nisha, for the question. Love pieces, okay. And says, thank you. Ashley Bailey, 0430. I have surgery Monday, lipo 360. Should I worry?
Should you worry about what? No, this is just such, we do this all the time, all day long, day after day. You should not worry. We've got great techniques. We've got great equipment. We've got a great anesthesia team. So you should not worry at all. All
And
right.
she's
So,
also asking, like, what is the pain level? Ashley.
well, it's actually 6.94. What is the pain level? It's moderate. It's not significant. It's moderate. You're going to take the pain medication. You could put ice packs. You're going to be in a garment if it's just liposuction or BBL. And those things also help to make things, make patients more comfortable. So it's not a huge pain level.
For a lipo 360, if she haven't had any lipo 360 before, when I woke up, it was very painful. But I know it's like it's as you said, it's tolerable after you take your medicines, and the medicines are super strong.
Super strong. So don't get behind on those, right? So don't think, oh, I'm going to push her for a couple hours. No harm is going to come to you taking pain medication for 5 to 7 days or so. So
Hmm.
don't worry about that. You're not going to become addicted. It's not going to be an issue. Take the
Hmm.
pain medication because it will become a bigger issue if you are not taking it. Then suddenly you're now behind the eight ball, and it sometimes can be hard to catch up. So you want like a steady level of the medication in your bloodstream to minimize the pain.
Jaja with attitude, like the one that you recommended, the martini. I was told I can drink I can drink my surgery is in 2 weeks. LOL.
Absolutely, go for it.
With Doctor. And
And
then
if the hemoglobin's low, just have a nice, glass of wine and a fillet, right? So you'll get the hemoglobin up also at the same time.
nails by Annika. Very good question. Do you have any fatalities?
Zero. All right,
Zero.
zero, zero, and nothing even close. Knock on. This is my
Mhm.
wood desk. So no, 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 zero, zero.
Thank you for asking, Nails.
Good
The
question.
real
It's a fair question.
plastic Barbie, the real plastic Barbie.
Oh, the real one.
The real one, yeah. Do you offer a pain shot after a BBL?
So that's the real fake one. So the real. Okay. So as far as the pain shot goes, um, we do that with the abdominoplasty, with the tummy tuck procedures.
Mhm, mhm,
Right, we use Exparel, which is a long-acting form of Marcaine bupivacaine. But with the BBL, we don't really, because we the medicine that we use during the liposuction, during the BBL, basically contains lidocaine, which is a local anesthetic agent. So you'll get lidocaine during the procedure, which will make it less painful afterwards. But there's really no specific pain shot for BBL because we'd have to inject the entire area. So
mhm.
we don't do that specifically. But again, like Lily was saying, the pain medication is very helpful following that procedure. And I've had
Absolutely.
I've had people who've had no pain at all following that procedure. Zero. Zero. I can never promise that, but I've seen it. I haven't believed it,
Mhm.
but I've seen it. And other patients have a moderate amount, but overall, it's not a
Yeah.
significant, a very, very painful procedure.
So you can discover it by yourself.
Exactly.
Everybody's completely different when it comes to pain, right?
Exactly. Of course.
Coach Nelly, I have my BBL May 5th with Dr. Jeff. I live in Georgia and have my lymphatic massage with my therapist here. I mean, in Georgia. How soon can I drive back? It's a 6 hours drive.
So I would plan to be here for maybe 3 to 5 days following that procedure.
Yes.
So we'll see. Don't you agree? So let's say solid 5 days would be really nice if you can do that. Because of the drive. But we'll get you started with lymphatic massages here. We have a phenomenal team, and it sounds like you've got somebody there who knows what they're doing as well. You want to only have somebody who's certified and does this, on a daily basis. This is what they do. And then when you do drive back, I assume somebody will be driving and you'll just be sitting there, right? She probably won't be doing the driving, but you'll be either, reclined in the back seat and resting, or you'll be, using the BBL pillow. And while when you're driving along, I say every hour, hour and a half, I had to get out of the car, walk around, that sort of thing. It'll be a lot more comfortable. Same advice for people getting on an airplane. Every hour or so, get up, walk up and down the aisle. You don't want to just sit there for 6 hours. All right. So when you get up, be a little bit active on the way back. But I would say a solid 5 days, Lily.
Yeah, absolutely.
Right?
Vishne Beauty Body Sculpting Bar. I thank you so much. You did my surgery.
Oh, I'm glad to hear that. You're very welcome.
Vera 94. This is questions in Spanish. I'm gonna translate it. How real is that in a breast reduction you lost sensitivity?
How common is it in a
Mhm.
breast reduction?
She
Not
said,
very.
yeah, if it's true.
Right, right. So basically, with somebody who needs a significant breast reduction, the breasts are on on a lot of pull. So there's a lot of weight on the nerves. It's the 10th thoracic nerve that actually goes right to the nipple to give you sensation. And there are many patients who have very large breasts who start off with very little sensation. Sounds like you have normal sensation, and really in most cases, you have normal sensation afterwards. In some cases, you have a little bit of hypersensitivity, a little bit of increased sensitivity following the procedure because now we've taken the weight, so you can't see below, but I'm lifting up here. You're taking the weight off that breast. It's no longer pulling as much on the nerve.
Oh, wow.
It's a mechanical thing. And actually, when you loosen that up a bit, the nerve can breathe a little bit. So you might have a little bit of hypersensitivity. And once in a while, from manipulating the pedicle, manipulating the tissue, you might have a little bit of numbness, but that usually resolves in a matter of weeks. So as far as
Wow.
long-term numbness, that rarely happens. It's very not common at all.
Awesome. Amber Lee, is Exparel for Lipo 360 BBL as well, or is just tummy tuck for tummy tuck procedure?
So we use it just for tummy tuck, okay? Because it's a material that we actually inject, at the site of the plication, the muscle repair, and also the flaps themselves. So we actually apply that in the below the abdominal flaps. So that's how we use it. But as far as the BBL, liposuction, there's really no good way to administer something like that.
Yaya with attitude, the one that's
A lot of
talking about
attitude.
the drinking, the nerves.
All right.
Hemoglobin is at 14.7.
Oh,
Wow.
wow. That's great. Well, it is an Olympic year. All right.
Yes.
And that's a great number.
You can have
So,
up to 7 procedures if you want.
exactly. That's hilarious. Exactly. At least.
Lipo, no, nails by Annika. Lipo or tummy tuck, which is more safe?
Lipo or tummy tuck? They're both safe, right? They're both
Yes,
totally safe
yes,
procedures. They're,
yes.
from my perspective, they're easy, safe procedures. Everything we do is 100% safe. I've never had a safety complication in my entire career. So they're all the same. They're all safe to me, which makes this one may take longer than that one. This one may, have a different healing, recovery period. But as far as safety goes, if you're my relative, I tell you that they are all equally safe, including the BBL.
Flag is 3637. Are you guys preparing in case of an emergency happens with a patient?
Of course, we're prepared. All right, so we can't do surgery if we're not prepared. So we have, a great anesthesia team, a great surgery team. We have great nurses. We're always prepared for anything that could arise. We have, privileges at multiple hospitals as well if we needed ever to transfer somebody. So we are always prepared. You don't ever have to worry about that. This is like
Okay.
a mini hospital over here. Did you
Questions.
freeze?
I wanted to know, I'm here. Yolanda Williams 752. I wanted to know, could you still have surgery and be on blood thinners?
Well, it depends, because we do blood tests, all right? And ideally, we're off the blood thinners for about 5 days before surgery because otherwise we're going to have a lot of excessive bleeding that we don't want. All
Mm.
right. So if you're, taking it because you had a previous history of a blood clot or a pulmonary embolus or the question, or heart valve, the question is, what reason are you taking it for? What are you taking? How much are you taking? And what do the lab values show? Then we need clearance from your physician, whether it's a cardiologist or whether, depending on the scenario, we definitely want to know more about that. But yes, we operate on plenty of patients who are taking, blood thinners, just not the day before surgery. All right, because that's going to
Yeah,
give us excessive bleeding, which we don't want. We don't want to
exactly.
develop a hematoma. We don't want to compromise our results. So no, we don't do it on people who are actively taking blood thinners. But that doesn't mean you can't have surgery. All right, so most physicians who are treating people with blood thinners will take them off of those 5 days in advance. It depends. People have different protocols, but let's have a conversation, discuss that. Then we can speak with your other physician and see if he or her, has an issue with taking people off thinners. Usually, it's not a problem, and then we resume
Oh,
them several days after the surgery.
beautiful. And Yolanda, even though she asked on the stories on Instagram, she's here. Nice,
All right,
Yolanda.
great. Good.
Elise Feliciano, AC1 on 7. What number for a tummy tuck?
A little high. All right, so you definitely want to be closer to 5.5 or 5.7. So I'm going to bring that down a bit.
If you want to have a tummy tuck, correct?
Right, or really most procedures. But yeah, for a tummy tuck, we definitely want to bring that down a
Oh,
bit.
okay. Okay. How many massages do you need for the first 2 weeks of your BBL?
I think it's like 87, right? Is it? Or is it 78? Um, I mean, basically, our team just makes that determination based on how much swelling and edema and all, and that sort of thing, how much progress we make with with each massage, but typically probably 2 to 3 a week. Wouldn't you say, Lily?
Mm-hmm.
So, and then our team will evaluate you and see if it's necessary to do three. Maybe they drop to two, but it's everybody's a little bit different, as Lily would say. So let's get you in and make a determination. But it's all everything we do here is really individualized. So I can't say, oh, it's 12 and you're done. So everything's individualized, and sometimes they continue for multiple additional weeks depending on
Yeah,
the progress that you're showing. Sure, great
but
question.
definitely starting next day after surgery.
Oh yeah, the next day we start the next day.
Yeah. We have another Barbie, Black Barbie 333. I will be to see you March 1st. March 1st
March
or
1st, interesting.
April 1st.
She's going back in time.
Maybe it's April 1st.
Oh,
Can't
okay,
wait. Can't
perfect.
wait. Can't wait, Dr. Jeff.
All right.
Enjoy
I
Christmas.
look forward to it.
Um, Sister War 32. I can't wait to come next year, but I'm nervous.
Oh, okay, good. Well, if you weren't, I would be, like I say, right? So, give me a shout, come and see me beforehand, and we could allay your fears. This is very safe stuff here.
Nikwa, hi, I'm scheduled for April 1st. I'll ask a question about, ask it again, please. Okay, Yolanda Williams, I'm taking 5 milligrams for a blood clot in my left ankle. I paid the deposit for the surgery, but I have not set the date yet.
5 milligrams of Coumadin or of what medication?
Blood thinners, but she said a blood clot, but I don't know what
There are a
medications.
bunch of blood thinners out there, but we have
Oh,
to
so
know,
put
like,
it there,
when this.
Yolanda, so we can see it.
That's okay, but the bottom line is that, when did the blood clot develop? Why did it develop? Does she have a longer history of those developing? Does she have a history of smoking, taking estrogen supplementation, things like that make her a higher risk for a recurrent clot? But ideally, if she's been treated, it might have been over the last 6 months, and maybe it's continuing now. But we'll definitely want to stop the medication with clearance prior to her surgery.
Okay. Toros have a question. She had surgery like a year ago, and she's asking for some things. So Toros, send me your name, your phone number. We
Sure,
can schedule. After a year, it's a whole year. So let's see. But
sure,
definitely we can check it out with Dr. Jeff.
absolutely.
Okay. Vin Beauty Scoping Bar. Um. Okay, I get a tummy tuck 2 year. I get a tummy tuck 2 year. Will my
2 years
result be
ago.
much better? I guess that's what she meant. Will my result be much better with a lipo 360?
Oh, okay. I think she's looking into the future, but in general, Lipo 360 is very helpful. Okay, because we're doing the upper abdomen and the flanks. That's really the front, right? There's no reason to do the lower abdomen because we're removing that portion of tissue, right? But the 360 also adds the upper and lower back, and when you add the lower back, that really improves the overall contour of the waist. So,
Mhm.
in my opinion, doing a 360 in conjunction with the tummy tuck is going to give you the best result. Is it critical? Is it absolutely
Absolutely.
necessary? It's not absolutely necessary, but it really depends case by case. So send us some photos. I'd be happy to look at them, and we can go from there. But in general, it will always improve the waist by doing certainly that lower back area.
Okay. Will I have to get a massage the day after my BBL and tummy tuck? Alicia Christina.
So
Yes.
usually we start them, yeah, right. So Lily just answered the question. That's
Yes.
our lover bell, Lily. Boom.
Yeah.
Yes. So the answer is yes. All
Yeah.
right. But nobody's going to touch the abdominal flap. All right. So I
Correct.
say this every time. Nobody touches that for like 8 weeks, or there's just no need for that to occur. But the flanks are good. The back is good. So that could all be, improved with lymphatic massage, which we do start the next day.
Yaya with attitude. Do you do additional blood work during the pre-op?
We do, and our team, coordinators can tell you all about that. We do full blood panels, full blood work, so nothing is missed.
Yolanda Williams 752. I'm taking
Eloquist,
Eliquis.
right? So, okay, my answer remains the same. All right. So the question, I don't know what her INR is. I don't know what her PT/PTT are. I don't know what these lab values are for her. But either way, we would need to, correct them, meaning she can't walk into the OR anticoagulated. All
No.
right, which is, no, that would make no sense at all. So that's fine. That's a very common medication. It's very effective. It's a good medication, but we need to speak with with your physician and determine you know what the protocol is for taking somebody off of that briefly, not
Mhm.
permanently, obviously, but briefly before surgery, so we don't have excessive bleeding during surgery, and then when we put them back on following surgery, might be 5 days later, might be a week later, that sort of thing.
If my surgery, this is another question, Alicia Christina. If my surgery is on a Tuesday, will I be able to fly home on a Saturday?
Well, what procedure is she having?
I don't know.
So she's having a breast dog, absolutely. If she's
Mhm.
having lipo 360 or a BBL, absolutely. If she's having a tummy tuck, well, probably not. All
Mhm.
right. I don't say absolutely not because that's about 5 days. So we prefer 5 to 7. I mean, in most cases, I think you're probably fine with 5 days. That's 4 days.
Mhm.
But yeah, yeah. So we don't want to cheat anything. We just want to keep an eye on you. Um, absolutely.
Okay. Coach Nelly, how many post-op appointments do we have with you after a BBL?
Oh, like 34, right?
More or less.
More or less.
You have a mandatory post-op with our amazing team of nurse practitioners the day after your surgery.
Right.
Normally, they see if everything is okay, and if you want to talk to Dr. Jeff, they have to call him and check, like, or bring him a gift, or
Yeah, right. No, I'm easier to get hold of than that. I was up there today a few times.
he
Like,
likes
yeah, yeah.
dragon fruit refreshments.
Oh, exactly. I mean, that's it. That's exactly going to do it every time. So yeah, yeah. So you can see me. I mean, I'll see you. A couple times. We have a whole team. A whole nursing team
Yes.
that will see you afterwards. So yeah, yeah. And any questions, they call me anyway. Or I'm wandering around aimlessly, and I'll roll into your room.
And
So yeah,
doctor, it's good for them to know too that because our med spa where we see our patients after surgery for post-op with a whole amazing team of nurse practitioners that we have and everything and nurses, you can actually go every day after your surgery if you want. You can just go before 1 p.m. and they're gonna check that everything is okay. Okay.
absolutely,
And of course, if we need Dr. Jeff to go too, he's more than available.
absolutely. Yeah, our team watches you like hawks.
Yeah.
They really do. Our
Yes.
goal is to have the best possible result and the happiest patients. So that's how we do it.
Yeah. Let me see. Okay, so Yaya with attitude had a question about the back. I have two free lipo areas that include the back, or do you have lipo the
It
back with the
doesn't
tummy
include the
tuck?
it doesn't include the back
No.
because with the back
Mm-mm.
it's really a different procedure. We're flipping the patient from the supine position on their laying on their back to the prone position laying on their belly, and that's really considered a separate procedure, which is done at the same time. We do it all the time, but that's not included in free areas. Free areas include like arms and thighs and chin and mons, any of those areas, axilla. There are many areas to choose from, right? But it doesn't include the back.
Okay. It's Miss Shanti. What is the difference in a tummy tuck and extended tummy tuck?
So the extended tummy tuck is a tummy tuck that has been extended. All right. So in other words, literally the incision is just longer to capture excessive skin that's kind of trying to turn the corner on us. All right. So it's just more work, more time in the OR, more suturing, more elevation, more dissection, all of that. So, but that's all it is. It's a tummy tuck. It's just a longer incision because that's only if we make an incision, like I say, this wide, then how are we going to get the skin that's over here? Right. So we can't. So it's really a geometry thing, right? So we make that incision, and my upper incision ultimately will be usually above the belly button, right? So we take kind of removing a section that looks like that, right? Like an ellipse. And based on the geometry, that determines how far out laterally we need to go to capture all of that tissue.
Mona C A R N, love you, Dr. Jeff!
All right.
Exclamation, exclamation,
Well, I appreciate it.
exclamation.
That's a lot of exclamation. I appreciate that.
Okay, let's see. I have a lot of questions here. I'm trying to do my best to get them all. I'm 2 weeks post-op. All the stuff was amazing.
Great.
Beautiful. I have other questions here, doctor.
Okay.
Unfortunately, I can take just two more questions.
Okay. Perfect.
Um, okay, so Char Parker, wound care for incisions after BBL. Any tips?
Wound care following
BBL.
BBL. Right. So basically, in the OR, we're applying, we're steri strips to these incisions, and there's not a lot for you to do. All right. So initially, we want to keep that dry for the first number of days. We're going to see you the first day after surgery. So we're going to check and make sure that things are starting to heal, that there's no infection, that everything is normal. So
Mhm.
not a lot for you to do. Don't you agree, Lily? I mean, there's really just not a lot for you to do. Just be
No, for a
vigilant.
BBL.
Make sure you don't develop a fever. Make sure nothing else is going on or turning red or things like that. That would indicate a potential infection. All right,
Mhm.
that but of course we're giving you antibiotics during surgery and also after surgery that you go home with a prescription. So infections do not occur very commonly, but once in a while they do occur, and we just treat them. So nothing else
Doctor,
for you to worry about. Yep.
I'm so glad you touched that point about the antibiotics because this is something that I've seen with the patients, and I want you to comment on that. They take the painkillers and you send them also antibiotics, right? But I've seen this very commonly when the patients are like, "Oh, I felt good. I didn't finish the antibiotics."
Yeah, don't do that. So
Yeah.
the antibiotics, we give you the right number of pills. Like with the pain medication, usually we give you like 30 pills, and you
Mhm.
take as many as you need, and you usually don't need more than that. With the antibiotic, we give you as many as you need, and you need to take all of them. Right? So
All
usually
of them.
it's a 7-day course, and usually we're using Keflex or that sort of thing, and that's 4 times a day. So we can give you 28 pills. So you should not have. It's like when you put something together. Usually, you should not have a bunch of extra screws left over afterwards. Same thing here.
With
Like
antibiotics.
with antibiotics, right? I draw the analogy. So you should not like finish the week and have like a bunch of pills still in the bottle. All right. So even though you feel good, you may feel good because there's no infection developing, you're doing great, you're healing nicely, you're coming along, but we don't want you to not feel good. So, don't take the antibiotics for a day or two and then just stop taking it because you feel good. All right. Even though you feel good, doesn't mean that you're not going to develop an infection, and if you do, you won't feel so good. All right. So
Absolutely.
just take them till they're gone.
Awesome. Well,
That's a
thank you
great
so much,
question.
doctor. Thank you, everyone. That's
Absolutely.
that's a great analogy. I'm
Great
gonna keep
seeing
it.
you,
I'm gonna
Lily.
copy. Thank you so much. Great to see
Absolutely.
you.
And I'll see you
And
guys next time.
happy Thursday.
Happy Thursday, guys.
Bye.